Good afternoon. My name is Chuck Norland. I'm a general pediatrician here at the University of Utah, and we'll be talking to you about a little bit about kind of providing an introduction to the concept of medical home, but mostly talking about a resource we've developed here to help clinicians and families implement medical home and take advantage of its potential. If you could switch to the slides. First, I have no financial disclosures to make, unfortunately. So what is medical home? The term was first used in 1967 by the American Academy of Pediatrics, and it's evolved since then to describe a model that extends usual primary care delivery to address a broader set of both patients' and families' needs. And these are commonly focused on patients with chronic conditions. The American Academy of Pediatrics describes the medical home as consisting of these characteristics: that it's accessible, continuous, comprehensive, family-centered, coordinated, compassionate, and culturally effective. As you can imagine, achieving all of these is a huge challenge, but a worthy goal. Our efforts here in Utah began in 1998, really before the term medical home became very popular. When the American Academy of Pediatrics chapter here did a survey of clinicians, asking them, what do you need, or what would you need to provide better care for children with complex and chronic conditions? The top three answers by far were access to best practice guidelines for the care of these conditions, knowledge of local resources and services, and having a care coordinator in my office. Well, the chapter thought that we might be able to meet the second of those, so we embarked on developing a pamphlet or brochure that listed local resources. It took a few months to create that, distributed it, and within another few months, half the data was out of date. So we figured, well, that probably wasn't going to be the best way to go forward. So in 2001, with the help of a federal medical home implementation grant, the chapter, the Utah Department of Health, and the university's Department of Pediatrics began trying to meet both of the first two needs through the medical home portal, a website that I'm going to introduce to you. This is the home page. The URL is shown at the top. You don't need the www. And as you can see, there's 5 major sections indicated by the tabs at the top within the site. I'm going to show you first a couple of screens that demonstrate one of the needs for the medical home portal and one of the huge challenges of providing a medical home for kids. So this screen, and I'm hoping you're seeing this large enough to read it, but if not, you can look at the site later on your own computer. Here we have shown a number of diagnoses that are found in kids with chronic conditions, and their prevalences as demonstrated by a variety of different kinds of studies, so you don't want to compare study to study. But if you enter your practice's size, if you're a pediatrician or a family doc, and you know the number of kids in your practice, then it'll calculate up the number of patients who are likely to be in your practice with each of those diagnoses. And this page shows the most common diagnoses: attention deficit disorder, asthma, depression, intellectual disabilities, mental retardation, Tourette syndrome, autism disorder, spectrum disorder. And as you can see, that those are relatively few in number, but comprise a significant proportion of a practice. Yet the number of diseases or diagnoses a pediatrician might have in their practice, in their patients, is many more than that. One of the bottom screens of this page, and there's probably 3 or 4 screens worth on the page, shows many of the less common conditions. Yet these are things that we spent a whole lot of time in medical school and residency learning about, but then may not see again, even in a career. So staying on top of all of these conditions, what the latest medical science, treatment, evaluation protocols are, and the local resources that are available to help with caring for these conditions is a huge challenge. So that's one of the aims of the portal, is to help pediatricians and family physicians, primary care docs, and other care providers, nurse practitioners, and physician assistants meet those challenges. So what I'm going to do is demonstrate for you what might be a typical morning in a pediatrician's office, and show you how the portal might be used in that setting. So hold on to your seats, because we're going to run through this fast, just like it might happen in the office. So it's just another day at the office in Utah, and we hope soon in Montana. And the pediatrician arrives after morning rounds, and his or her MA, medical scheduler, and nurse are all waiting with questions. First question: Ramon, your 8-year-old patient with Prader-Willi syndrome, vomited twice this morning, but doesn't really look very sick. Should we see him today? Second question: the health department called about Jessica, a 5-day-old with positive newborn screen for medium-chain acyl-CoA dehydrogenase deficiency, also known as MCAD. What do we need to do now? And a 4-year-old patient scheduled this afternoon is new to the practice and coming in for a well-child check. The schedule says he has Fragile X. Is there anything special we should know or do? And Juanita called about her son, who was recently diagnosed with autism. Having read a lot of confusing stuff on the web, she's anxious to know how to find reliable information about autism, about planning for his schooling, and how to help his siblings deal with this new diagnosis. And after a long hospital stay, Tiffany just went home with a new tracheostomy, and the home care company wants orders and a letter to support the need for an inline humidifier. So we all take a few deep breaths and tackle them one by one. So Ramon, back to the 8-year-old with Prader-Willi syndrome. So if we go to the medical home portal, we'll find Prader-Willi syndrome among the lists of diagnoses in that diagnoses and conditions section. And if we click on that link, take us to the first page of that module where it's got a description of Prader-Willi syndrome, and we see a link called Pearls and Alerts. Scrolling down that page, under those Pearls and Alerts, we'll find their statement that individuals with Prader-Willi syndrome rarely vomit. So we click on that link, and it takes us to the page that tells us a little bit more about that. And indeed, Prader-Willi syndrome, children with Prader-Willi syndrome don't vomit very often, and when they do, it can mean something much more serious than the average child. So given that might represent a life-threatening illness, we're going to bring Ramon into the office. And just in anticipation of that, we look further down the module under gastrointestinal and bowel function to learn a little bit more about that and find resources that might be helpful for us. So if we click that link that says Services under Pediatric Gastroenterology, takes us to a link at the bottom of that page from which we can link to the pediatric gastroenterology providers in our neck of the woods. And there we list 2. So now we know who to contact and how to get a hold of them if when we see Ramon we feel like we need more help. So now we move on to Jessica with the positive newborn screen. So on the right-hand corner, the rightmost tab is newborn disorders, which takes us to this page, which lists on the left-hand side all of those disorders that are typically screened for in newborn screening programs. We see MCAD there, so we click on that link, and that takes us to a page. And each one of these disorders has a page in the portal that gives an overview of the condition, key information about what you need to know as a primary care clinician when you first see a patient with this who's had a positive screen. Further down the page, it describes clinical characteristics, and then what are you going to do when you get notification of that positive screen? So as you see in the red rectangle there, it lists what our first steps would be and how to contact both the screening program and the medical geneticists who would be the experts in helping us evaluate and eventually manage this child. So we're just about to move on, but then we remember that, oh my gosh, this family is actually moving to Oklahoma next week. So we go back to up to the top of the page where we've got a drop-down list of states who are collaborating with us, and there's Oklahoma. So if we click Oklahoma, that'll change the services information that we provide anywhere within the portal to the services we have from that state. And as you can see here now, the newborn screening program is Oklahoma's, and it gives us a list of pediatric medical genetics providers in Oklahoma. If we click on that, then we go to the list of those providers in Oklahoma. This child happens to be moving to Oklahoma City, so we click on the University of Oklahoma link and get information about who and how to contact those folks, and we can give that to the family, even give them a call ourselves and let them warn them about the family coming. Then we go back to, well, what are we supposed to do with this after the diagnosis is, or the newborn screen is positive, we find there towards the bottom of the page more resources to learn more, both for professionals. Here we've got ACT sheets that are developed by the American College of Medical Genetics. And then further down the page, whoops, took a little bit, we find more information for parents and patients. So we can refer the parent to find more information for themselves on the web about this condition. So now we can move on to the 4-year-old coming in with Fragile X. We don't have any patients in our practice right now with Fragile X, so we need to know what to do. So going back to the diagnoses and conditions section, we find Fragile X syndrome in the list on the left. Pull that up, and scrolling down that page under practice guidelines, we find an article linked to about health supervision for children with that condition. Clicking on the full text link, we're linked to a report in American Academy of Pediatrics just on that subject, on how to deal with the health supervision for children with Fragile X syndrome. And that page, further down that article, we get a diagram that lists the elements of health supervision for children by age group. So we can see there that for early childhood, 1 to 5, we should do those components so we can prepare for that visit adequately and have the whole staff ready for that child when they come in. So now we can move on to Juanita, and she is here with her son who is recently diagnosed with autism. And again, they've been to the web and found what a confusing place that can be, but particularly for conditions like autism. And she'd like to know how to find more reliable information. So if we go to the parents and families section, we'll see a variety of items in the menu there that address the issues that are common for parents with kids with chronic conditions. And we have a particular focus on what parents who have a child with a new diagnosis, though those whose diagnosis has been there for a while and are first coming to the site will also find information that's valuable. And there, if you expand the other menus, you'll see much more information. So we're mostly looking right now for learning about the diagnoses. So if we go to that page, we'll find information about how to find and use information that's within the portal and how to relate to medical home providers and getting information. A little bit about how families oftentimes react to and cope with new diagnoses. And then further down the page, we provide information guidelines on how to recognize reliable information when you find it on the web. So this information should apply to information anywhere on the web and help you assess its reliability and validity and its ability to answer the questions you have. We also provide further down that page some specifically reliable web links to information on the web. And then we go back to, well, what specific information or links can we provide this parent for information about autism? So if we go to the Autism Spectrum Disorders Diagnosis module in the Diagnosis and Conditions section, we'll find there under Services and Other Resources links to specific sites that have reliable and valid information for parents. We have actually a number of those listed. Some of them are specific to Utah, but if for states that are collaborating with us, we replace those with information provided for that state. We also list on those pages support sites for parents. So those specifically focus on social networking sites and support groups that are local and or national. And then since we're interested still in providing more information about education, if we look in the physicians and professionals section, we find information about education in schools. This is a fairly abbreviated version focused on just what primary care clinicians need to know to be able to help families. But we also provide there a link to the Parents Guide for School Services, which is back in that Parents and Families section. And here, this is a longer page that goes into detail about the legislation that helps drive the services provided in schools, what parents' rights and responsibilities are, and how to access those services and take advantage of primary care clinicians to make sure you're getting the services that your child needs. And again, we provide specific links to more information that in this case go into detail about some of those legislations, and the Parent's Guide to, for example, Section 504, and then again, more specific, state-specific resources. And then she was also interested in how to help deal with the siblings of this child with autism. And we have a page that addresses that specifically because that's a huge challenge for many families. Most families find that the typically developing children, or those without a chronic condition, grow significantly from having a sibling with a chronic condition or disability. But making sure that those kids get the most out of that and don't end up being impacted negatively, having some guidance on how to approach that really helps parents substantially in terms of feeling comfortable with how to approach their children without the chronic condition. And now we'll go back to Tiffany. So she's the one who just left the hospital with a new tracheostomy, and the home care company needs some help. So we haven't had a patient in our practice with a tracheostomy in quite a while. So in the physicians and professionals section, we have a section called Technology Reviews, where we review a number of technological components of care to help guide clinicians in how to help patients who are taking advantage of those services. So our tracheostomy page goes into some detail on the background of tracheostomies, what you need to know about the equipment itself, and how to help care for it. And here we provide specific information about humidification, tracheostomy ties, suctioning, that can help guide our giving orders for the home care company in terms of what they should be doing for this patient at home. And then the company needs a letter of medical necessity, and we're not really sure what the components of that ought to be. So if we go up to our search box and type in medical necessity, it'll take us to a search returns that lists a number of resources within the portal that talk about how to write letters of medical necessity, and some even provide examples. So if we click on the first one of those, we'll go to a page that focuses just on that and provides the components of a good medical necessity letter, focusing on what the insurance company will need to make a wise judgment about that. And at the bottom of the page, we list, again, links out to other sites in the web that provide information on how to write letters and requesting medical necessity. And then we also provide sample letters for a variety of conditions. We don't happen to have one on tracheostomy, but we have them on several other conditions that give sample letters that have been de-identified to help the clinician or their staff get this letter written. So now, in a matter of just a few minutes, we've found the needed information and resources. We've been able to assign our staff the tasks to take care of in preparation for seeing those patients, and now the clinician can go off to see the first patient of the day. But now I'd like to spend a little bit more time showing you one of the key sections that we're actually working with folks in Montana on that I think makes our portal significantly useful at the local level. And that's our services and resources section. I showed you a little bit about that earlier. If you go to the community and professional services component of that, here you'll see a list of about 250 categories and subcategories of services that we've obtained information about. Here in Utah, we've obtained that information from a variety of sources, one being our Utah 211 program, which is a not-for-profit entity funded by United Way that maintains an extensive list of not-for-profit services for both adults and families and kids. We filter their list that they provide for us and for those services that are relevant for children and for families, and you can see the top part of this listing. And then we also collect information about professional services that aren't collected by Utah 211 by a variety of sources using our Department of Health, care managers at a variety of clinics and at the Department of Health, and our own searching of the web to find these resources. So here we try to compile and identify all of those professional services, both in healthcare, dental health, mental health care, that might be important for a family of a child with a chronic condition, so that both the families and their clinicians can readily find them, but also even to know that they exist. Because a lot of times, you don't know what you don't know, and you're faced with a problem and you don't think there's going to be help out there. Browsing this list might help you find services that you otherwise would have been unaware things as uncommon as perhaps music therapy, genetics laboratory, pulmonary function testing, etc. So we're working with a number of states to collect their information locally, and then what we do is we replace Utah's information with that state's information. Work with our collaborators in those states to make sure they're properly categorized, and then make that available. The list I showed you earlier of other states we're collaborating with includes primarily states from the Midwest. They're collaborative on. It's called the Heartland Genetics and Newborn Screening Collaborative. So they list primarily genetics resources, so it's not a very robust list. We're working with Idaho as part of a CHIPRA grant so we've collected their 211 information and are working on getting their professional information in there. And we're working with several organizations in Montana, listed here, to compile both sets of information for Montana. We've got some of it already and are continuing to work with them. So we encourage you to help collaborate with these partners on helping to collect that information, and then we hope that you'll be able to use the medical home portal to improve the care delivered and the outcomes for kids in Montana. Our funding primarily is currently coming from a CHIPRA quality demonstrations. That's the Children's Health Insurance Program Reauthorization Act through the Centers for Medicare and Medicaid Services. And we have funding through that through February of 2015. And here are the contacts here in Utah. Mindy Tueller is our portal manager. I'm the medical director for the project. And on each page of the medical home portal, you'll find a link for feedback, which will give you access to enable you to contact us. So I've run through a lot of information pretty quickly, hopefully to give you a sense of how accessible that information is, how easy the portal could be to use. And now I'd like to open it up for any questions or comments you may have or suggestions on how we can better make this serve your needs.
Any questions?
Comments? I don't know, Tanya.
Is there a microphone?
We've had a hard time, of course, trying to collect data from our sites across Montana. So if y'all know of providers in your community that are particularly serve children with special health care needs, we know about DFS and stuff, but therapists and other organizations, please let us know. Cindy, myself, or my partners, we're all trying to fill the blanks on our portal, and certainly it's going to grow as time goes on. Certainly, I'll add to this, I surveyed my patients to see what they wanted, and they really wanted this. They really wanted to be able to look up services in Forsyth and Glendive and Glasgow and wherever they were. Yeah.
Would there be a way to integrate this in with discharge planning? Patients leave the hospital, various specialty guidelines and stuff that you're usually demonstrating. Frequently, you see a provider in the rural area, doesn't know much about these illnesses, and those links were, just guided right in, so the information they get back from the center.
So you're asking if these links could be sent to the, I'm sorry, I'm not sure I'm understanding. Hang on.
Hopefully, when somebody's discharged from the hospital, there will be a discharge plan from the provider that took care of them in the hospital to the provider that's going to be assuming care. And it's very difficult for the provider at the hospital to write out in all detail how to deal with a very complex illness, but just tying these links in so the provider out in a small community 200 miles away knows, oh, that's a place I can go to get this information, would seem to me to be, something that might be a possibility.
I like the way you're thinking. And indeed, that's something that we're working with our subspecialists here and our hospitalist group at Primary Children's on having them take advantage of our site to indeed do that, include a link to the page in their letter to the primary care clinicians, and also to be able to post on there their particular algorithms or protocols for care of specific conditions. And this was going to apply not only to chronic but also more acute conditions. For example, chest pain and syncope are two that they're anxious to get on the portal because those are conditions that oftentimes the specialists don't need to see if they can be worked up adequately at the primary care level.
What level of health literacy are you expecting parents who access the portal to have?
That's a great question and one that we struggle with. So we have a number of parent advisors who've worked with us over the years. We have 2 who are active partners and attend all of our team meetings, which happen every 2 weeks. And in the family section, we try to aim that at somewhere between 6th and 9th grade reading level. It's a challenge with medical content because a lot of the words that we're, of course have to use don't meet that criteria, but we try to focus that at that reading level as much as we can. But our parent partners tell us that for the medical content, they don't want us to, and the quote is, dumb it down. They want to be able to learn the language that their providers use. So we've written the content of the diagnosis modules at a level aimed at primary care clinicians, expecting the parents will be able to access that information also, but may have a little trouble understanding it the first or second or third time they read through it, but that with effort they too will be able to understand that. They'll be able to learn the language that their clinicians use, and that will empower them to be much more effective partners with their clinicians, both at the primary care and the subspecialty level. We're in the midst of redesigning the site a little bit, so we're going to restructure the diagnosis modules so that they're a little bit more accessible, we hope, not as much repetition in them. But also we're adding to that a parents page for each of those modules, and we're going to structure that parents page to answer some of the very common questions that clinicians get from parents, answer those briefly, again, aimed at a lower education level in terms of the reading level for those pages, but then encourage patients and family members to access the full module and get through as much of it as they wish.
I have a telemedicine question, and that is, if you build it, will they come? And it would be interesting to see what your utilization of the portal is, first off, and whether that's matured over time, whether you're seeing more activity. The other interesting thing, I'm a physician internist, and with the web-based information systems, if indeed the pediatrician fails to read the information, but the parents do, the parents are going to be smarter than the pediatrician when they come into the office. And I was wondering if there's any mechanism of capturing the parents that are coming onto the web page so that I, as a primary care physician, could be alerted that they already have read the material.
Great questions. So first on the utilization, we have seen a significant increase. So about a year and a half ago, we were getting about 7,000 to 8,000 visits a month. Now we're getting between 12,000 and 16,000 visits a month. About 75 to 85% of those come from search engines, and they come from a variety of search terms. But we're one of the few sites that has much information on some of these more rare conditions. Interestingly, one of our most popular pages is the Letters of Medical Necessity page. We have about 15 to 20% of our visitors are return visitors, but we don't have any ability currently to know who is visiting. So we could do some analyses of patterns of navigation through the site and make some guesses about whether this is a clinician or a parent, but we really don't have any way of knowing who is visiting right now. We're developing some tools that we hope will be so compelling that that will enable people or will encourage people to log in, let us know a little bit about themselves, and then we can figure out more about how that kind of person, whether that's a parent, a care coordinator, a clinician, use the site, and then we can use that information to iteratively improve the site. That one of the tools that we're developing is the ability to have your own favorite list of these resources. We would be able to automatically compile lists based on your, who you are, or what your interest is, what diagnosis you're interested in, where you live. But then you could, delete or add to that list the resources that you're interested in, both the services in your local community, but also web links. And then we would continually update that, so every time you access the list, it would have the latest information given your criteria and specifications. So we hope that that will enable us to get more information about our users. So that pretty much answers your last question about whether we could let you know that your patient had accessed this. No. However, we have talked with a couple of clinicians over the years about them providing this list through their own EMR web portal for patients. And that might offer an opportunity for us to be able to do that. If your patient accessed a diagnosis module through your portal, then we would know that they came, and we could at least let them know. We wouldn't be able to tell you who did unless you were able to track that, because that would be PHI that we would not want to be responsible for.
Anyone else? Well, once again, I do want to reemphasize that we are trying to get the Montana portal up and going for resources. So if you have any of those resources that you would like to have included, obviously we're going to probably get it up, and we will find great gaps that we have not thought about. So, but we have the ability to update it. Thank you, Dr. Norland.
Thank you all very much.
With that, we have